Hi, Constash Donald and Shaw os Grogan's Puttigar Sedangin. Today I'm going to have a brief discussion on conjunctivitis, swelling and irritation of the conjunctiva, which is the protective layer that covers the whites of the eye. There are three types of conjunctivitis: irritant, allergic, and infective. Infective being the most common and the one I'll discuss today. However, just as a brief synopsis, irritant would be if there's an irritation caused by something like chlorine or an eyelash getting into the eye which causes an infection. Allergic would be when an allergen causes an immune response in the conjunctiva, causing irritation and inflammation. We'll focus on infective, which is caused by a virus or a bacteria. Typically results in red watery eyes. It's very common in children, or it's very difficult to prevent contact between children, usually accompanied by a sticky discharge, mostly apparent in the morning. Symptoms of conjunctivitis it normally begins in one eye, then moves to the other after a day or so. Redness of the whites of the eye, eyes can become more watery than normal, discharge, weeping from the eyes or stickiness, especially in the morning time with the eyelashes stuck together, irritation, especially maybe feeling like a grittiness in the eye, possible upper respiratory tract infection symptoms like a cough, temperature, sore throat, headaches. It's important in babies in particular that sometimes there may be a discharge of sticky eye resulting from a blockage of a tear duct which can't drain away properly. If, however, there's also irritation and redness, then it's possibly conjunctivitis, so it'll be important to see a doctor, especially if a baby is under 28 days. Different tips to help if conjunctivitis is present: the use of gauzes or cotton pads to remove any stickiness or going from the eye in the morning, moving from the bridge of the nose out to the outside of the eye, and then disposing of the pads to prevent any reintroduction of the infection, washing the hands correctly and often, not sharing of towels. Disposable handkerchiefs can be handy in this, so when you're cleaning the eye, then to dispose of them afterwards. Single use. Most bacterial conjunctivitis is self-limiting, so therefore it will clear itself after a week or so. Disposing of any drops that you're using afterwards is also a good idea to prevent reintroduction. Treatment options: golden eye and brolin come in a drop or in an ointment form. They're over the counter. It's not an antibiotic, however it does have bacteriostatic properties, so therefore can be very useful in minor eye infections. It can be used from birth. It's 1 drop 4 times a day. If there's no improvement after 2 days or so, then you should see a doctor. If the drops are too difficult, then the ointment